So welcome to my basement office where I seem to have spent most of the last 100 days. I'm Alistair. I'm a digital leader in the city of Leeds, looking after the integrated health and care digital support agenda. So what reflections have I got of the last 100 days? Well, I suppose it first started off with recognising that there was a big gap in the availability of PCs that would allow GPs to work from home, out of office. The stock had mostly dried up. Much of it was created or manufactured in China, but actually one of our city partners, Leeds City Council, had stock. So initially it was that movement of stock between or with City Council, CCG out to GP practices, enabling them to work in a remote fashion. Then it went parallel, looking at on the third sector, the voluntary sector. They had huge shortfalls in the technology that would allow their vulnerable groups to keep in touch, both from a care, a health, a well-being perspective. So we arranged grants so that voluntary sector organisations could bid for, could be laptops, it could be data for mobile, data for phones, SIM cards, etc. But really the idea was that we could support them as a city with a small amount of technology that would help their vulnerable groups stay in touch. And finally, I suppose it's been about keeping the core function going, big ticket items such as the Leeds Care Record, developed in partnership, ensuring that those conversations, relationships could still happen over new technologies, existing technologies, Skype, Teams, etc., to ensure that no critical strategic items stopped. So that was a very quick thumbnail of the last 100 days. Let's see what the next 100 days brings about. Thank you.